Welcome to the Cancer Has No Border podcast. I'm Zach Randles-Friedman, and today I'm really happy to be joined by Lynn Godfrey. Lynn is the Chief Constituent Experience Officer for Blood Cancer United, which was formerly the Leukemia Lymphoma Society. Hi, Lynn. Thank you so much for being here today.
Oh, thank you. It's a pleasure.
So tell me a little bit about who you are and what your organization is.
Of course. My name is Lynn Godfrey, and I am the Chief Constituent Experience Officer for Blood Cancer United. What does that mean? I oversee all marketing and communications for the entire national organization. And I've been with Blood Cancer United for 5-6 years.
And how long has Blood Cancer United been around?
That is a very good question. Timing is everything, because Blood Cancer United, we just changed our name as in a week or so ago.
Yes.
We were formerly Leukemia Lymphoma Society. And so the organization has been around 76 years.
Wow.
We are a world leader and focused on blood cancers, providing advocacy, investing in groundbreaking research, and most importantly, I believe, critical patient support, information, and resources. So a long history, decades of impact, but now we have been debuting this new name. So I'm just getting used to saying it.
And you have a new website?
And we have a new website,
bloodcancerunited.org.
That's
okay.
right.
Got it.
We're making a presence known across social media, et cetera. So for 76 organization, we got a fresh start, so to speak.
So why did you decide to do a name change, though? Like, what kind of inspired that?
Yeah, that's a great question. I think it really started when we as an organization embarked on taking a step back, recognizing we celebrate our 75th anniversary, tremendous impact, billions of dollars invested in research, 70% of FDA approvals we have had a hand in funding, so bringing to market, so fantastic. But we also knew it was an opportunity to say, what do we want to do going forward? And our president, Dr. Andy Kolb, set an ambitious goal for us that we would look to extend 1 million years of life for blood cancer patients. And what does that mean? For so many of our patients who are experiencing all different types of blood cancers, there's not an immediate cure or treatment. Sometimes it's about how can you live and extend the months, weeks, years that you have as comfortably as you can have with family and friends. And so that's what that's about. And so that caused us as an organization to say, well, what would be required for us to get there? And for myself and my team, we took a step back to say, well, we've been 25 years as Leukemia Lymphoma Society. Yeah. It's about time that we take a step back to see, are we still relevant? Is our message still connecting, reaching the people who would most benefit from what we have to offer?
Yeah.
And after doing exhaustive research, it became very clear that not only did we need a face lift, so to speak, so that we stand out, make it easier for people to find us. But there were challenges with our name. Leukemia Lymphoma Society served us well, but the reality is it doesn't accurately reflect the scope of who we are and what we do. Because the truth of the matter is we support all blood cancer patients.
Yeah. And how many blood cancers are there?
There are over 100.
Yeah. I don't think people know that really.
That's exactly right. And the leukemia and lymphoma represent or the most prevalent of the blood cancers. You would add myeloma and you're probably getting around 80% or so of those blood cancers. But our name was unintentionally not welcoming in 20% of other blood cancer patients. MDN, MPS, I'm not even going to be honest with you, if I tried to pronounce them, we'd be here for a very long time. But that's just not acceptable for us. I mean, we've always invested in research. We've always provided information and care. We've always advocated on behalf of the entire community. And it was time for us to have a name that was much more reflective of our mission and our vision for the future. And so that's why we changed it.
How much have you invested? I think I read that you invested around $1.8 billion to date. Is that correct?
That's right. In research, in groundbreaking research, which is significant.
That is huge.
And I really need to thank all our wonderful partners or volunteers or donors or supporters who've made that possible. But yes, we've made a significant investment and it's continuing. In fact, I think we have about 200 or so research projects in play right now. And I think just last year alone invested over $150 million in research. So it's significant.
Are you global or are you US only?
We have a presence, meaning a presence, physical presence, staff on the ground, so to speak, across the United States as well as in Canada. So in North America.
Yeah.
But the work that we do in terms of investing in research and treatments and care, that has a global impact.
It's exactly.
I mean, there's such a close-knit community that knows no bounds or boundaries, actually. Yeah. So the treatments that we're directly involved in supporting and driving, that can have a huge impact that sort of radiates out across the globe. And so while it's not literally a global presence, I think
it's a global impact.
Exactly. Yeah. That's right.
Just to kind of go back to the rebrand a little bit, our company just went from Beijing to B1 earlier this year.
Congratulations.
Yeah, thank you. And it's a lot of work. So talk to me about how did you reach out to patients and kind of talk to them about? Tell me a little bit about that.
Yeah. So being a hardcore marketer, from our perspective, you always start with your audience.
Yes.
What are they thinking, feeling? How do they currently perceive you versus perhaps how do you want them to perceive you, et cetera. So research was very much at the core of this effort, and it's certainly in tune with the culture of the organization. We're data research driven, so we approach this with research. In fact, I think it's safe to say we talked to over 7,000 patients, volunteers, staff members, partners, donors, both people who have worked with us in the past or we have had a relationship with in the past, as well as those who did not. We talked to a lot of patients who have been navigating blood cancer but had never heard of, at the time, Leukemia Lymphoma Society. And so it was so critical to get that feedback from all those different voices and people to make sure that we're making the most thoughtful choice. I mean, at the end of the day, we want to present ourselves in a way that really is welcoming and that conveys a meaning and an emotion that's relevant for people. And after looking at 350 different options, literally, and I'm probably underestimating the number.
I know what you're talking about.
Yes, I know you can appreciate that. There's a lot of rigor that goes into that. And testing them, quantitative, qualitative, the Blood Cancer United kept coming up as a name that conveyed, first of all, that it was inclusive of all blood cancers, that it conveyed this sense of community, which is something that I think is part of our secret sauce. We bring together researchers and volunteers and scientists and partners from all over the country and part of the globe to all under a common cause. And so, but also practical matters. It was easy to say and spell. And it's easy to find. Again, if you imagine a patient who's just heard the most devastating diagnosis, they come out of the office, they may not know what to do, and immediately you think they're going to pull out their phone and look on Google search or what have you. We want to make it as easy as possible for them to connect with us and to find us. And we think this name is going to do that for us.
So you're doing research on a global scale. So tell me a little bit about how the organization is funding and fueling innovation globally. Talk to me a little bit about that.
Sure. So Gwen, who leads the research team, is a physician and scientific researcher. And she believes in the peer-to-peer review process. The research team makes decisions and does careful analysis, hearing what the needs are from patients, hearing what the needs are from healthcare providers and some of our medical partners. Like, what is the next area? What are those germ of ideas versus what are also work that might be in progress that perhaps needs a little uplift or push in terms of resources, financial resources. And so the team comes together, decides on making those allocations, but then, and in a lot of cases, especially when it comes to reviewing grants, deciding which research projects we're actually going to fund or support, we adhere to the best practice of peer-to-peer review. And so we pull together scientists from all around the country and parts of the globe to review the grants, to score them, to see which are going to be most effective, make the biggest impact from a clinical perspective, from a treatment perspective. And that's how we go about making our decisions. But as you could well imagine, it's a very lengthy process. I mean, the time it takes from starting a clinical trial or starting research to actually a treatment that's been proven safe and is approved and bringing that to market could be anywhere from 10 to 15 years. So today, the treatments that patients are receiving is research that began almost 2 decades ago,
Yeah.
potentially. So
Yeah.
a long runway.
Yeah. And tell me a little bit about your partnership that you have with Blood Cancer UK.
Blood Cancer UK, they are like-minded sort of in the cause,
Yeah.
right? To treat folks in the UK with blood cancer. We have had interactions with them over the past couple of years. And what we're doing is talking about ways that we can raise awareness in our respective territories
Yeah.
about blood cancer. You know, a lot of people get a diagnosis. It might be a form of leukemia or lymphoma, but they don't often make the connection, or depending on who their care provider is, they don't really always know that it is in a category of blood cancers. And so that is really important. There's not a high awareness about what blood cancers are, that there are over 100, that they're difficult to, if at least right now, not possible to screen for. Early diagnosis is key to a positive outcome, but it's a disease unlike colon cancer. You can have a colonoscopy,
Yeah.
breast cancer, a mammogram, et cetera. Or you could change your diet or your lifestyle to help improve or prevent potentially the incidence of the cancer. Blood cancer is not like that. And so making people aware of what it is, the different type of diseases, in general, what to look for, but most importantly, the importance of advocating for yourself is something that we are linking arms on to figure out how to do together.
Wow, that's a great mission.
Yeah.
Can you talk about just how more about how you're fueling innovation globally, and like what's your global impact?
You know, when I think about the work that we've played a huge part in over the past 76 years, there's so many innovations, everything from most recently CAR T therapies, which we began to invest in research in the late 90s, early 2000s. This idea that each patient could have a personalized form of treatment based on using their own immune system to fight the cancer cells in their body. I mean, that in the 1990s, that seemed like something out of science fiction. Yeah. The fact is today, immunotherapy is quite common practice. It's become a treatment that many not just blood cancer, but other cancer patients have been able to benefit from. So this idea of personalized treatment is a field that opens up a wide array of opportunities. Yeah. And we are positioning ourselves to be at the forefront of investing and focusing on that type of research. And I think the other big frontier is diagnosis. I mean, early diagnosis or detection or prevention. I mean, right now, as I said, that's just not possible because of the nature of blood cancers. I mean, and one other piece, it's multi-generational. I mean, you have infants all through young adulthood who can be diagnosed with a blood cancer. Most prevalent is leukemia, for example. Yeah. And then as you get a little older, your 40s, 50s, 60s, and upward, that's when you tend to see high incidence of blood cancers. Or sometimes people who have been treated for a different type of cancer later on develop a blood cancer.
Do you think that the future of kind of being able to get diagnosed or detected, do you think that's something we'll see in our future?
I certainly hope so.
Yeah.
I mean, that is something I can tell you that our president, I'm calling him Dr. Andy, but Dr. Kolb would say he has that in his line of sight.
Yeah.
But at the same time, again, we recognize that for many patients, depending on the type of blood cancer they have, there is no cure right now.
Yeah.
And so for us, a lot of times our focus on treatments we're always focused on cures, but a lot of the times the treatments that we're talking about are about extending life, making it possible for you to live with the cancer, with the disease, but in a way in which you can enjoy more moments with your family, your colleagues, birthdays, anniversaries, go to the basic things like going to the supermarket and shopping for yourself. Yeah. Like if you've gone through months of, chemotherapy, radiation, et cetera, just that act alone is a gift. Yeah. And so we are really looking at it from a holistic point of view, a realization that if it's about helping a family member spend more time and see and have more experiences and can and at the same time feel like they can deliver and make an impact in their community,
Yeah.
that's a win. That ideally will evolve to cures, but we're looking at it from a short-term and
Yeah.
a long-term perspective.
Since I've been in the pharmaceutical industry for a long time. I don't want to age myself, so I'll just say a long time. And until I worked at B1, I did not understand how important research and clinical trials were.
Yeah.
And we've done some interviews with patients over the past year or so, where some of them have been in clinical trials,
Yes.
and they just talk about the extra care you get and how important it is for the research and stuff. Can you tell me a little bit about your feelings on the research and clinical trials?
Clinical trials, research, and participation in clinical trials is the heartbeat,
Yeah.
frankly, of innovation. Without it, we wouldn't have achieved within the cancer space, within the healthcare community, all the major innovations. So the interesting thing about clinical trials is so important to reach out and get a variety of different participants in the trial. Because at the end of the day, the purpose of the trial is to test the safety, the efficacy, have a better understanding of what potential side effects are, and hope that the intention of the treatment is going to not just meet expectations, but perhaps and oftentimes they might have unintended positive impacts for different types of cancers and or diseases. And so the attracting a diversity of participants in a clinical trial is absolutely critical. The impact of a treatment on a woman in her 30s of childbearing age is completely different than a man who's in his 50s or 60s. And there are also ethnic and racial differences.
You got to think about the diversity of where they're living and their background, because it's all...
Right. So participation in clinical trials is critical, which is why we do a lot to help patients navigate that space. Because there's very, as you could well imagine, very little understanding in general about what is a clinical trial. There are a lot of times misinformation about them, fear depending on the community or people that you're talking to. And so we offer one-to-one support, not to recommend a clinical trial, but to provide information and facts about the different clinical trial options that may be in play, so that ultimately a patient and their family can make the best decision for them. You know, what is the process to get into a clinical trial, which health care, if you need to navigate insurance concerns relating to a clinical trial, all of that information, all valid questions and concerns. We have dedicated folks who work with patients and their families to help them navigate.
I just, again, just since working here at B1, we're doing our clinical trials 100% internally now. So we're not using any CROs. And it's just, I think it's just so amazing the care that a patient gets when they're going into it. And I never understood that until recently.
You know, I can tell you, I'm thinking of a volunteer who we've worked with for almost 15, 20 years. When he was 36, 37, very new family. He and his wife just had an infant girl, and he was diagnosed with chronic myeloid leukemia, which at that time, 25 years ago, there was a very short lifespan predicted. I mean, I think he had 3 years projected to live, and there was no clear treatments, and certainly not a cure. But fortunately for him, he was able to enter in a clinical trial, actually one that our organization was funding and supporting, which then resulted in him taking one pill, which has since extended his life. So what was originally only a 3-year life expectancy, that was extended by 22 years. So 25 years, each day takes a pill, and he's been able to see his infant grow up into a college graduate who's pursuing a career in science and research. He has fundraised and trained on our behalf during those years. He's become a fierce advocate for blood cancer patients, for access to care. All of these experiences he's had with his family, friends, meeting new people, making an impact to other patients and their families because he got involved in, participated in a clinical trial.
He must be so grateful for that.
I think yes, absolutely.
And his family must be, his son or daughter that just is graduating
That's
college.
right.
That's amazing.
Yeah.
That's an amazing story.
So a clinical trial, not to sound a little cliche, is the gift that keeps on giving.
Yeah.
It's
and you're helping so many other people as well.
That's exactly right. Not just yourself,
Yeah.
but yes, you're helping so many other people.
Yeah. Tell me a little bit about how your organization, you talked about this a little bit, but a little bit more details about how your organization supports the patient.
Yeah. I think that's, frankly, we take a very holistic approach to how we work with patients. It's very personalized. And what I need to clarify, because we're not providing treatments or care. We're not a hospital. However, what we do is provide one-to-one support. If you're newly diagnosed, you can call our Information Resource Center and be connected to a specialist who can answer your questions, can put you in contact with resources, can help you navigate what are the things that you need to think about in terms of insurance approvals, in terms of perhaps how you might want to, the forms you need to fill out, what the courses of treatment are. Again, providing information, but also listening, quite honestly.
Yeah.
Because so much of the work with patients is really providing that emotional support and well-being.
It's scary. You imagine.
Extremely so.
You find out that you have cancer, a blood cancer, and then you never have. Like if I found out about it and I've never known, where do I go? How do I learn about it? What do I do?
That's right.
And that sounds like a great resource that you have.
That's right. So there's one-to-one care. We have a program that matches newly diagnosed blood cancer patients with a volunteer who may have navigated, is either in remission or has gone through the course of treatment, so that you can really talk one-on-one with someone who's been in your shoes.
Yes.
And that means so much. We provide support, everything from conferences where you bring people together to talk about their experiences, to podcasts. We also provide a lot of information support around financial health and well-being. A lot of times I think you see people ringing the bell.
Yes.
And if you've never had any experience with cancer, oh, that's great. Your life goes back to what it was before. And that can be furthest from the case. As you could well imagine, the cost of treatment is so expensive. I think around 42% of cancer patients drain their life savings in 2 years of treatment.
Wow.
And so we have a lot of patients who physically may have a clean bill of health, but from a financial perspective, they're in some dire straits. And so we've recently rolled out a program to help patients navigate financial debt.
It's amazing.
So not providing relief, but helping them. How can they make some decisions? How can they be pointed to resources to help them get their arms wrapped around the debt and slowly begin to whittle it down so it's not crippling for them and their families?
Yeah.
I think that's the other piece that I would say in our level of patient support. It's not just directly the patient. It's also providing support to the caregiver.
Yeah. Tell me a little bit about the caregiver, because the caregivers are so important. And it's not, it's the patient gets diagnosed, but it's impacting the whole family.
Absolutely.
And so tell me a little bit about how you're supporting caregivers.
No, that's a great question. We in the same level of one-to-one support, matching people with specialists, matching caregivers with fellow caregivers, having that sense of community, and having a way for a caregiver who may feel that they're not empowered. Like they see a loved one who is going through arguably the most difficult time in their life, and they want to be this champion for them, but what more can they do? And a lot of times that might mean channeling their energy into advocacy. So we provide that means to literally work with our advocate team to talk to their local legislators to how do you ensure more access to care or insurance policies, et cetera. The other way is whether you want to fundraise or just, again, meet someone who's gone through this experience with a loved one who's just providing an ear. That means so much to someone who is just sort of grappling with how to manage things. And then the other piece I would say is, especially a family where you may have a child or a young adult who's impacted, but there are other children.
Yeah.
The impact on the family unit is across the board. And so for the caregiver, it's how do you help them if they're trying to figure out, they provide support for the person who's sick, but then they have healthy kids. And how do they get lost in the mix?
Yeah.
So it's really, it's a very complex, multi-layered, I would say, approach that we take. And one where we try to be thoughtful, we listen, we provide factual information and guidance, but always the idea that we're leaving it up to the family to make those decisions that are right for them.
Amazing. Tell me how, you've taught me something today that I had no idea there was over 100 different.
Oh, yes.
Tell me a little bit how your organization is generating awareness around blood cancers.
So now that we've made this change to Blood Cancer United, we are doing a lot of work on educating the public writ large about the complexities of blood cancers. How is it different from what's referred to as a hard tumor cancer? So for example, a breast cancer, colon cancer, in terms of detection, et cetera. I mean, the fact that I'm here talking to you and you're asking me all these great questions, that's part of what we're doing to raise awareness about blood cancer. So a lot of efforts in working with our partners, doing community outreach, making sure people are aware of our resources and programs. We're and partnering with, again, we mentioned Blood Cancer UK and other folks who are like-minded and want to make sure that people are aware of the intricacies of this cancer disease. So
I have a question about just kind of going back a little bit about once you've brought a patient in and you've given them those resources and they're on the other side.
Yes.
Do you have a lot of people that do come back and they're so grateful that they do want to volunteer?
That's a great question, because I think we have people who have started off as patients who have come to us and have participated in our programs. And then they're energized, they want to do something. So they'll participate in one of our peer-to-peer fundraising campaigns, like Light the Night, for example, and fundraising on behalf of the work that we do so that other families could benefit. Or they decide, I'm really interested in advocacy and going on the Hill and telling my story to help persuade or change the mind of a local legislator to make some decisions that will benefit all patients so they get access to care. Or in addition, we have a lot of staff members who start off as patients, volunteers, advocates, and then they're so interested and committed to the organization, they join our team.
Oh, I love that.
In fact, there's a terrific woman who's on my team. She's an avid storyteller. She's a production specialist, 3-time survivor of blood cancer, who has been with the organization, I don't know, close to 10 years or so.
Wow.
So yes, it goes full circle a lot of the times. That's what you find.
Tell me a little bit about early detection. What can people do?
Well, and that's the tricky part, because there are a lot of symptoms when you have a blood cancer that mirror other diseases.
Is there a lot of misdiagnosed with blood cancer?
Yeah, there are a lot of misdiagnoses, a lot of stories of patients who it took them a really long time to get the diagnosis. And as you could well imagine, early diagnosis is critical or yields more positive outcomes. Yeah. I think what I would say about early detection, because to be honest, truth be told, you can be in the best shape, physical shape, eat the right things, you still could be diagnosed with a blood cancer. That is possible. I would say is really be, number one, in tune to changes in your body, in your health. No one knows better than you what you're feeling and experiencing. And if something doesn't seem right, you go to the doctor, and doctors do the best that they can. Yeah. And if you're not feeling that you're heard, then go to another doctor. Seek information and advocate for yourself. I know it's easy for me to sit here and say that, but I can tell you that I've had 2 friends who've been navigating cancer, and one of the things that they both have said how important it is to advocate for your own self-health and well-being, and to connect with a team of healthcare providers, first and foremost, who you feel are listening and really attuned to your situation. I think that's really important. The other thing I will just say is blood cancer, so oncologist, I'm sure people have heard the term, I'm going to go to an oncologist, and that's someone who specializes in cancer. But a blood cancer specialist is someone who's a oncologist hematologist.
Okay.
So, and that I don't think is well known either,
Yeah.
that there's a specialty within oncology, which makes sense since there are different types of cancers. But if you are really moving down that road, and for whatever your symptoms are or test results, I think it's important to understand the role that hematologists play. They are the true experts when it comes to blood cancer. And in many instances, you might work with a hematologist, an oncologist together, et cetera. It depends on the situation, but I think it's important to know that.
So let me ask you a question. Whenever a patient is first diagnosed,
Yes.
what should they do?
When a person is first diagnosed, certainly they should, and I know you're there and you have to digest it.
Yeah.
You're feeling stunned, I could well imagine. I think it's important, whatever your reaction is, to take a moment, either for yourself or whoever's with you or your loved one or friend, and then start writing questions down.
Yeah.
And saying, okay, what does this mean? What type of cancer is this, depending on the diagnosis? Yeah. Going back to the healthcare provider first and foremost, and making sure you're exploring every avenue. You try to get as much understanding as you possibly can. If you run right away to looking things up, that depending on who you are and where your frame of mind, that sometimes can be helpful and sometimes it can't be. It depends.
You may not get the Google search that you want if you do, right? Yeah.
I would say certainly come to Blood Cancer United.
Yeah.
We have information that covers every form of cancer. You can talk to someone in our Information Resource Center who could probably help guide you. Even if you start off with, I just got this diagnosis, I'm not sure what my first step should be. That's very helpful. But definitely you have to start with your healthcare provider. That's absolutely critical.
Okay, great. Anything else you'd want to say to let people know about anything about your name change or anything, or just...
I would just say this, for those folks out there, patients, volunteers who've known us as, and scientists, researchers who've known us as Leukemia Lymphoma Society, we are the same organization that has been steadfast in our mission for 75, 76 years. Our mission has not changed. Our programs, the support, our commitment has not changed. What has changed, yes, is the name. And it all comes from making it as easy as possible for patients to find us, researchers to find us, and so that they can access all the resources you need. So we haven't gone away. We've just evolved. Yeah. Like everyone does. You go through a process, and we've evolved to meet the needs of patients and their families today.
Yeah, 76 years is a long time.
It is.
You have to evolve.
That's right. Exactly.
Well, everyone should go and check out bloodcancerunited.org.
Yes.
They can see your new website, your new brand, and who you are. And I really appreciate you being on the show today. Thank you so much,
Zach.
It was great. It was great to have you. Thank you.
Thanks.
Be sure to follow us and subscribe to our podcast on Amazon, Spotify, Apple, or iHeart. You can also subscribe to the video version of the podcast on YouTube. Thanks so much.